480 people will get diagnosed with cancer today. 24 people will die of cancer today. It is one of the biggest threats that exists to human life currently in this state. And timely diagnosis and treatment will and can make all the difference for so many people. The Irish Cancer Society stated that it's worried that many people have cancer and don't know it, and this will impact on their outcomes. The Marie Keating Foundation anticipates a tsunami of cancer diagnosis, and maybe the figures that you just indicated show that those delayed cancer diagnosis are starting to come into the system at the moment. Research that we in AIM2 have done recently showed that there's a significant drop in the number of patients who are starting anti-cancer therapy treatments. In 2019, there were 8,252 patients who started on chemotherapy, hormonal treatments and immunotherapy. In 2020, this figure was down to 7,683. So far in 2021, it's down to 5,703. Breast check, bowel screening, cervical check, skin cancer clinics, chemotherapy rates, radiotherapy rates are all down. And we need extra capacity put in right now to deal with this.
Minister.
Thank you, Deputy. I agree with all of that. So in terms of treatment, the numbers are as follows. So for chemotherapy, this year versus 2019, we're at 95%. For radiation oncology this year, it's January to August versus 2019, we're at 85%. And surgical oncology, January to August, is 80%. Now, critically, these figures don't include the private hospital capacity, which has been used by the public system. So the overall figures are higher. Nonetheless, I couldn't agree more in terms of the need to invest very seriously and very significantly. So, as the Deputy will be aware, €12 million was made available for cancer restart services to deal with COVID-19. So this was for backlogs, clinical times, additional clinics, diagnostics capacity. Last year, I allocated €20 million to the National Cancer Strategy. This year, for next year, I'm allocating €20 million again. And importantly as well, it's probably discussed. Well, I'll come back on it, sorry.
Thanks, Minister. Deputy.
See, I do understand, obviously, this is a difficult situation for the government, and nobody expects the government to be able to deal with this 100%. But we talk about capacity here ad nauseum in this chamber. But if you look at the differential between the number of ICU beds there should be and the number of ICU beds there are, that's a differential of 260 currently. Now, there's about 112, 117 people with ICU, with COVID in ICU at the moment. So the lack of capacity is actually a bigger threat to ICU capacity than COVID patients currently in ICU. There's a differential of 8,000 beds currently in what there should be in the hospital sector and what there is. That's 16 times the amount of people with COVID in hospital beds. So the lack of capacity from the government's investments into hospital beds is 16 times worse a threat to capacity in hospital beds than actually COVID is at the moment. We need to really set out a significant plan of major investment in capacity. There's 1 million people on hospital waiting lists. Even outside of COVID, there is a necessity to build capacity. And the idea that the government are looking to close down ICU beds and A&E beds in hospitals like my own in Navan at such a time of need is just hard to believe. And I'm asking the government to say here today that they will do a step change, a radical step change in the investment in hospital capacity in this state to deal with COVID and these other health issues.
Minister, to conclude.
I'm very happy to give that commitment and say that it is already underway. So in the last year, we've had a record increase in hospital beds. Very shortly, we'll have added about 1,000 hospital beds. Now, to the Deputy's point, there are somewhere over 500 COVID patients in hospital at the moment. So we've added twice that number of beds in the last year. We're in the middle of the biggest increase in critical care capacity on record. We have added more clinicians this year, and last year are the top 2 years in terms of additional workforce since the HSE was established. In terms of critical care, I know there's another question coming up on it very shortly and we can get into the detail. So I agree, Deputy, I agree absolutely with what you are demanding. I'm demanding exactly the same thing. We need an unprecedented and historic increase in capacity, and we are in the middle of that. And we need the same targeted investment in cancer services. That's why this year the National Cancer Strategy has had full funding for the first time. Next year, it's getting full funding again. About a third of the 50 million on new drugs for this year will be going on cancer drugs. So there's an awful lot of catch-up to be done, and we are moving and investing as quickly as that capacity can be added.
Thank you, Minister.